been widely reported, we have a patient now at Bellevue who is being assessed for the possibility of Ebola. Tests are underway. At some point this evening, it may be very late this evening, we'll be able to provide the public with information on the results. The important facts to know here, without going again into too much detail, the individual in question is a doctor, has been able to work very closely with public authorities in providing information. A very careful protocol has been in place now for weeks. This protocol was followed every step of the way, including the initial contact with the individual, the transportation to Bellevue, the protocols at Bellevue. Everything has been followed very precisely, and the assessment process is underway. So I want to commend the FDNY and EMS. I want to commend the health department, obviously everyone at Bellevue and HHC, because their weeks and weeks of preparation have paid off, and a very seamless operation was undertaken today. The important thing to remember here is until we have full information, we can't draw conclusions. So we want to be careful not to make assumptions until all the testing is done. I also want to emphasize, in the midst of what is obviously a crisis that causes deep concern, we've seen some important evidence in the last week of the capacity of modern medicine to address this crisis. Thank God the nurses who have been touched by this crisis here in the United States and in Spain are all getting better. In fact, the nurse in Spain has been declared absolutely safe at this point. We have seen time and again that when a case is caught early, that a great deal can be done to resolve it. And certainly we do know for sure that if this turns out to be a case, that this was caught very early. So we are hopeful, regardless of the next steps, we're hopeful for a good outcome for this individual. But very important for the public to know that every protocol has been followed, and our emergency personnel, our healthcare personnel have responded admirably in this situation. Again, at some point this evening, possibly very late in the evening, we will be able to tell you more about the patient's status.